Good morning, everybody. It's Teitsort with Chronicles of a Culture Changer. It's August 7th. It's in the morning. And I mentioned that when I first started this thing, the Chronicles of a Culture Changer, that I was trying to share that, it's not all glitz and glamour and getting to travel around and meet people that 8 to 13 hours a day, 7 days a week is usually spent here in the office trying to spread the message about, violence in healthcare, particularly in emergency medicine. Today, it's going to be a little bit longer than normal because I want to try to help you with some of the things that we've been sharing across the country and see if I can't help prevent some of these acts of violence that are occurring against us, and also, believe it or not, some of the violence that staff might be using against true medical patients. And this is playing off of what we talked about yesterday with reasonable. And when we define that, we said reasonable is defined as usually just, rational, usual, or appropriate under the circumstances. Well, with that, there seems to be a huge confusion across the country because we say that a patient restraint situation is the leading situation in which criminal assaults are occurring upon staff, and it's also one of the ones where staff have actually been assaulting true patients or assaulting people that should have never been a patient to begin with. So we're going to play a little game, so to speak, and we're going to kind of work this out together, you and I, and see if we can't answer a few of these issues regarding patient versus an aggressor. So we'll just do it as a simple yes or no. And really, it's all going to boil back down to, are you safe? Because the question is very simple. If you're not supposed to start an IV unless you can do so safe. You're not supposed to lift a person unless you can do so safely. You're not supposed to drive an ambulance or a rescue unit unless you can do so safely. So we have everybody else's safety but ours in when it comes to violence. So everybody's always thinking about patient safety, patient satisfaction. We want to discuss, what does the provider need to do to be safe? Because if the provider is safe, we're finding that they're offering better patient care, that they have a better attitude about work. So there's a lot of things that are in there that we can help with just this one little section here. So this one's kind of important. So number one, the question will always go back to, are you safe? Are you safe? Do you feel safe? Is this situation safe for you to treat a patient? Just like you wouldn't go into a hazmat scene, just like you wouldn't go into a raging flood waters if you couldn't do so, if you didn't have the training and equipment and so on and so forth. But right now, we're just going to kind of whittle it down. Remember, not everything is 100%, but this will help in a lot of the cases, at least according to our research. And again, I'm not aware of anybody else that's spent any more time researching this subject over the last 17 years than we have. So as far as researching and training staff. So the first thing is, do this. I want you to look at it and say it like this. If you take what a person says and what they do, it equals your reasonable belief of their intent. I'm not saying that you're right or wrong or how it goes, but it's what they say and what they do. So if the person says they want to kick your butt and then they try to kick your butt, that is probably not a patient. However, if you have someone, and I'm trying to figure this out here as I work this for the first time doing it this way, if you have someone whose movements appear defensive in nature, means they're pulling away from you, they're afraid of you, that's probably a patient. So someone who's hypoxic, septic, diabetic, which is hypoglycemic, hypovolemic, that sort of stuff. So let's say, for instance, you were dispatched to the report of a person they found unconscious on the side of the road. You show up, law enforcement is present, and they start telling the person, listen, you can either go to the hospital with them or jail with me. And you're smelling the guy, and it's obvious that he was, intoxicated. Your assessment's not revealing any problems. You get in the back of the truck and you do what we've told you, where you say, look, man, we're not the police. We're not wanting to take you anywhere you don't want to go. If you don't want to go with us, let us know. We'll pull over somewhere safe and let you out. That's what we're talking about if someone is doing the whole hospital with them or jail with me kind of a situation. And then have your admin speak with their admin, because this is one of those situations that's getting a lot of our people assaulted. So if you get in the back of the truck, the door's just shut, the law enforcement drives off, and the guy turns around and says, you know what, F this, man, I want out. And you go, sir, just let us take you over to the hospital where you can, get off the street here. Can we, help you get someplace? And the guy says, no, F you, let me out of here. You don't let me out of here, I'm gonna whoop your ass. So the question is, patient, yes or no? Well, right now your assessment said there is nothing other than the fact this person's been drinking. Well, take what they say and what they do will equal your reasonable belief of their intent. So it's your reasonable belief. If you believe this person is wanting to harm you, they're telling you they're going to harm you, and they're trying to harm you, our belief is this is not a patient. This person is not a patient. So let's say you get called to a local mall where a person's just not acting right. You show up and the person is about 50-ish years old, and they're spinning in circles, or talking in circles, or saying weird and strange things and all that sort of stuff. People have gone ahead and called law enforcement, and they kind of get this person corralled, and they at least follow your instructions enough to get them onto a stretcher. As you attempt to take an check, the person screams at you and kind of smacks their hand away as they're pulling away from you. When you finally get the check, it reveals that their blood sugar was low, and you begin your treatment like that. So my question is, patient or an aggressor? Well, what they say, what they do, so what did you believe their intent was? If you turned around and believed this person was actually a patient based upon the fact of they were hypoglycemic, that they didn't have intent, what you had a reasonable belief of their intent to harm you, there it is. That's a patient. So that's green. Yes, that's a go. Well, and we can play these all day long with all different types of situations. It can be a head injury, it can be whatever, but all you have to do, folks, is break it back down to what they say. If their words aren't making sense, and then they're not trying to physically assault you criminally moving forward, and you think that their acts are defensive in nature, that they're afraid of you, that they're confused, that's a patient. That's somebody that we should be treating. If it's a person who is high or drunk and they tell you they want to hurt you and they try to hurt you, listen, we're asking you to back up, let them out, do whatever, just do so safely, because everything boils back down to we're asking you to only do your job safely. Don't not do your job. We're saying do your job, but only do what you can safely. I still have a hard time with this because people are doing stuff that is unsafe because they feel compelled. Not because it's right versus wrong, but they have this feeling of compulsion of helping in a situation they've had zero training to handle, and this is what is getting us hurt more often than not on the job, or causing those that are big, strong, tough, whatever, to hurt those people that they shouldn't have been hurting because there's confusion between a patient or an attacker. So if you have any questions on it, email me and I'll help you out. You can send me an email to kip@dt4ems.com and I'll gladly help you out, or feel free to post something here in the thread on the Culture Changer. Anyway, have a great day and we'll talk to you soon. Hope that helps.